This video provides some advising information specifically for the psychology major at USD. The psychology major requirements include 2 lower division courses, Introductory Psychology and Statistics, as well as Research Methods, Psych 300, and at least 1 course in each of the 5 pillars of psychology: biological, clinical, cognitive, developmental, and social. All students also take a capstone class in psychology and have to fulfill 3 elective courses. This means 3 additional psychology courses that are free choice for the student in terms of what they're interested in. These courses make up the total of the psychology major at USD. New in the 2026-2027 catalog, students can declare an emphasis in the major. This emphasis would replace the 3 elective courses to require students to take courses from a particular list that align with the content of the emphasis. These emphases include clinical mental health, child and human development, health and wellness, and social and cultural processes. These emphases are optional. Students can continue to declare a psychology major without an emphasis and take the coursework described on the previous slide. If students decide to take an emphasis in the major, they still fulfill all of the basic psychology major requirements, including statistics and research methods, and at least 1 class in each pillar of psychology and a capstone class. But instead of 3 free electives, they would take 12 units of coursework related to their emphasis. The coursework would be listed on your DegreeWorks audit, or you can see your advisor for more information about what classes count in which emphasis if you are a current student and you are thinking about redeclaring to add an emphasis.
The clinical mental health emphasis focuses on empirically validated methods for the promotion of mental health, as well as the prevention, assessment, and treatment of psychological disorders. The emphasis is particularly useful for students interested in pursuing advanced training in clinical and counseling psychology or psychiatry, as well as related fields such as social work, medicine, health policy, and ministry. Students choosing an emphasis in clinical mental health are required to take courses from the following foundational list, as well as emphasis-specific electives, all of which concentrate on the application of psychological principles in the service of improving mental health. The coursework will cover key topics in clinical psychology, including assessment, biopsychosocial theories, diagnosis, and evidence-based treatments.
The Child and Human Development emphasis explores how people grow and change from infancy through adulthood. Students take a range of courses examining cognitive, physical, and social-emotional development across the lifespan, while also learning the research methods used to study development. This emphasis supports career interests in healthcare, education, and social services, and also prepares students who are considering graduate study in developmental science or developmental psychology.
This emphasis provides a rigorous exploration of the intersection between physical health and psychological resilience. By synthesizing coursework in things like health psychology, sleep science, and positive psychology, students in this emphasis will gain a multifaceted understanding of the biological and behavioral drivers of wellness. The curriculum is specifically designed to prepare scholars for the complexities of modern healthcare, covering individuals' choice and responsibility, along with larger dynamic social factors, offering an essential foundation for those pursuing a variety of clinical and applied roles after graduation, such as physician's assistants, occupational therapists, and nurse practitioners, but also it helps to prepare those interested in careers in medicine and health policy. Ultimately, the program empowers students to better understand and therefore implement evidence-based strategies to improve health outcomes for individuals and promote systemic well-being within broader communities.
The emphasis on social and cultural processes is designed to engage students in the theories and methods used to understand the impacts of social situations on our own thoughts and behaviors, as well as how our own behaviors impact those around us. Students who select this emphasis will gain an in-depth understanding of the social, cultural, and psychological mechanisms that influence how people develop close relationships, align themselves with groups, navigate conflict, and make decisions that impact others. Because we live in a social world, this emphasis will be useful in all fields, but it will be especially helpful for students interested in pursuing careers in business, education, law, sport, social work, or graduate programs in social psychology.